how children eat changes how long they're likely to live. How children eat changes their appearance, their weight clearly, but also their likely adult height. How children eat changes the way they think in measurable ways, test scores and school performance. How children eat changes the way that children feel, also in measurable ways. How children eat changes the way that kids are likely to get ill on a given cold and flu season, how often they're likely to get sick, and how quickly they're likely to recover. How children eat changes how likely children are to develop chronic illnesses such as asthma, type 2 diabetes, health problems like hypertension or cholesterol problems, both as adults but even as kids. How children eat changes the way they behave. The science behind that is something that's a subject of another talk. But what I want to say today is that today we are standing hip deep in a childhood obesity epidemic that visibly and irrefutably gives us evidence that the way we're feeding children in the United States is failing them. It's failing them. You know, it's said that kids are what they eat. And to a certain extent, that's true. Children are built from food. And if children came with an ingredient label on them that listed ingredients in the order of what goes in, we now know from scientific evidence from the latest USDA publications that the number 3 ingredient on the average American child today would be soda. Kids are built out of soda, and it makes sense. Soda's everywhere. It's even predominant here at the National Gathering of Pediatricians. The number 1 ingredient, if children came with an ingredient label, the number 1 ingredient would be white flour treats. That's what children aged 2 to 18 are built out of in the United States today. So this year, an intrepid small band of volunteers set out to change that with something we called WhiteOut. And this small band of volunteers included Karen Herzog, who is our strategist and social media director, Richard Sachs, who's our creative director, did a lot of the amazing artwork and design of materials, Cheryl Green, who's executive producer, and myself, and a host of other volunteers. But what we set out to do in changing the childhood obesity epidemic was to focus on a leverage point for real change. We know now that the obesity epidemic that we're hip deep in starts very, very early. It's something that in the U.S., by 9 months old, the obesity epidemic wave is already here. I'm not talking about healthy, chubby, breastfed kids, but processed food-fed babies who are already having excess fat cells, excess adipocytes, and altered metabolisms. And how that happens is another, again, a subject for another talk. But the number 1 source of calories in the first year of food calories is processed white flour that we call rice cereal. It's babies' first taste of food for the last several decades, most babies in the U.S., at the most impressionable moment. When they're learning what food is about, when they're hungry, they're looking forward to it, there's this positive time. We know that if kids are exposed to a flavor 6 to 10 times, they're likely to develop a preference for it. 94% of parents don't do that with a vegetable or fruit. But when it comes to white rice cereal, they get it again and again and again, often with a video camera rolling and tears on mom or dad's face. We solidly imprint kids on this. So this group of people decided if we want to make a change, it's a simple one. Let's end white rice cereal for babies in 2011. Let's end this decades-old practice. Now, there were a couple of obstacles in the way. Grandparents swear by it. Parents choose it. Pediatricians across the country this year were recommending it as the best food to give babies, the best one to start them on. And major corporate interests very effectively market it to physicians and to families. So big obstacles. How could we possibly overcome it? And that's why we're here at the AAP Office of the Future Tech Talk Theater, because it's through technology, through social media and social networks, online and off, that this change could happen with little budget, leveraging what's happening, the way people are connected online. I want to tell you a little bit about that story. But one of the things I want to tell you is that, for those of you who are following on iPads, if you go to the second slide, that's the WhiteOut slide. It shows our Facebook presence, our Twitter presence, some of the gorgeous WhiteOut babies that were drawn throughout the course of the year. But by using social media, Facebook and Twitter for families, HealthTap is a social media platform for physicians, which if you don't know about, you can visit us right across the way shortly afterwards. But by using social media, we were able to spread the word. We also identified key places where parents network offline. In New York City, it was Big City Moms. In Dallas, it was Metro Moms. In Boston, here in Boston, it was ISIS. And because parents are connected to each other online and off. So we would do a tweet, we would do a talk, and it would spread virally. To the extent that now, wherever I travel across the U.S., parents have started questioning this white rice cereal. They've heard about WhiteOut, or they've heard that, wait, this may not be the best thing. And I can announce today that just last week, Medscape, who is one of the largest places that physicians go online, released results of a survey that was really impressive. At the beginning of July, they surveyed more than 10,000 physicians and said, what's the best first food? And they were asked, you can put white rice cereal, a whole grain cereal, fruit or vegetable, meat, egg yolk, other, whatever you check, as many as you want. And far and away, in July 2011, still, the number one food, almost twice anything else, was white rice cereal. But then they blasted out the WhiteOut message. They sent it through their apps, they sent it through their mailing list, they put it up on their website and featured it. It was the number one story of the day on Medscape overall, and the number one most read story of the month, because people were sharing it back and forth. It was emailed and again, networked across the internet. And at the end of the survey, after exposing people, a survey of over 10,000 physicians, 93% said they would no longer recommend white rice cereal. Rapid change. So how is this happening with no budget, changing physicians' minds, physicians' practice, grandparents, and thank you, Francis Moore Lepay, for grandparents, and among others, working with the grandparents, and parents. I took along 7 lessons very quickly that I believe are what made this work this year. And if you're following along, the first one of those is illustrated by the slide of Martin Luther King Jr. Today, his memorial is being unveiled in Washington, D.C. The first thing that's important if you want to leverage social media for major change is choose something historic. It needs to be big enough to capture people's imagination, and it needs to be in tune with history. The direction history is moving. If you're whitewater rafting, one of the first rules is keep your bow headed downstream, keep paddling, and you can overcome or go around huge obstacles. And there are huge obstacles to this, but because it's moving in the direction of the data, the direction of moving towards whole foods and paying attention to what we're eating and not just eating processed foods, that's part of what made this possible. The next slide shows a picture of 3 elevators. And that's because the traditional elevator pitch does come into play. You know, Martin Luther King's message was complex, but you could boil it down almost to a sentence, having a dream that the people would be judged by the content of their character rather than the color of their skin. Lots of details to talk about, but you got the message in a sentence. If you want to create social media change, it needs to be something that's not any longer than a tweet. It needs to be very, very quick, highly, highly focused. So with WhiteOut, it was really simple. Let every child's first grain be a whole grain. They won't mind, they'll thank us for it. And let every child's first food be a whole food. And with a simple, simple message, the rest of the data, people can go and read the white paper and learn the science behind it, which, by the way, you can get at drgreen.com/whiteout. You'll see all the studies behind this. The next slide shows somebody dealing with network and phone cables in a very complex picture. And that is the next thing is whatever you do has to be extremely simple and not terribly complicated. If we tried to, I have a book, Feeding Baby Green, that we'll be giving away in the Health Nuts media booth right after this, the first couple hundred folks who come by. And it's a detailed program for teaching nutritional intelligence, which is the simple age-appropriate ability to recognize and enjoy healthy amounts of good food. But this is a 33-month program, and the family, tens of thousands of families do it every year. It's changing kids' lives. It works, but it's complex enough. It's not going to be a massive wave of change like WhiteOut is. It needs to be very, very simple. The next thing that I learned, which is there's a picture of some rubber ducks in a barrel, is that beyond being simple, it also has to be easy, the change you're asking from people. And it's simple to say you should lose weight. It's simple to say you should exercise more or you should spend your money more wisely. But it's not easy to do those things because the habits are ingrained. But one of the reasons that WhiteOut is so successful is to start babies on the right food is easy. They're at this stage where they'll put anything in their mouths. If we waited until they were toddlers already, when what's called neophobia has set in, where they become suspicious of new foods, actually physically afraid of new food sources, which makes sense. You wouldn't want a toddler to walk away and pick a berry and eat it or a leaf and eat it because it could be poisonous. It could be dangerous for them. At that point, it's hard to change eating patterns. At that point, most kids in the U.S. won't eat any servings of whole grains on a given day. But when you're starting solids, it's simple. It's simple and easy. So historic, tightly focused, simple, easy. The next one shows somebody who's all excited because she has found stuff on sale. It needs to be a bargain. Whatever you're asking people to do, it might cost them something, but they have to see that the rewards are huge compared to what they're getting. It feels like a bargain. And again, this is a tip for parents. Parents are worried about food battles with kids down the road. They've seen picky eaters. They know kids who only eat bland stuff. And all we're saying is, it doesn't need to cost any more money. Or if you do the most expensive stuff, it's just a few dollars more a month. It's really a bargain what you get for kids' health, and that helped make this powerful. Number 6 of the lessons we learned during this shows an hourglass. And I believe one of the things that made this happen this year was by setting a time limit on it. I've been talking about switching white rice cereal out for many years now. I've talked to corporations about it. I've talked to retail stores about it. I've talked to parents about it. It's prominent in my book from 2009. But it wasn't until we sort of put a stake in the ground and said, okay, enough is enough. Let's do this change in a year that it caught hold. So setting a time limit for the goal. And the last one shows a picture of somebody gossiping. And whatever message you have, it needs to be the kind of thing that people spontaneously want to share with others. Part of our campaign was, let every child's first grain be a whole grain. Let every child's first food be a whole food. It'd be an avocado, a banana, sweet potato, whatever. But it was the kind of things that parents wanted to tell other parents. Did you hear about how white flour can predispose to diabetes? And because they wanted to share it, it became not me to a few people. It became people to people to people to people to people, taking advantage of the social network structure. So those were the things that I believe made it a success. And where we're headed this year are 2 offspring from WhiteOut. One of them is called Color In. Very simple. Of what you want, what you can do to how do you feed kids. We created a very simple little feeding guide that you can download free and use however you want. It's at drgreen.com/colorin. It's 3 do's and 3 don'ts for how to start solids. I'm not going to go into them here, but I'll tell you the very first one. The first one is that when that baby's getting their first bite of solids, rather than sitting them away in a high chair and feeding them, bring them to your table and share some of the food together. Let your baby's first meal be a family meal. Start that pattern of eating the same food together. And again, it could be a whole grain oats or rice or sweet potato, banana, whatever. You can read about that, but that's the first one. The other thing we're tackling this year is called tick-tock, which means transitioning from immediate cord clamping to optimal cord clamping. Because in that 75 seconds or so between instantly and after maybe 90 seconds clamping the umbilical cord, several tablespoons of iron-rich and stem cell-rich blood are transferred to the baby, which are enough to carry them through, in most cases, the nadir of iron. So that's the reason we've had to fortify our cereals, is because we've skipped that. This happened throughout most of human history and in every known species of mammal. So I'm hoping this year we change baby's first meal to a family meal and the other things that are part of Color In, and that we change cord clamping big changes, things against them, but can be done with these same things. I hope you'll join us with that. Hope you'll join us over in the Health Nuts Media booth afterwards to get a free copy of the book, and over at HealthTap to learn about physician social media. Thank you very much to the AAP Office of the Future. This is exciting to see where practice is expanding both within the walls of our practice, but outside, actually creating public health change. It's an era of participatory medicine where we're getting involved with our families to change health. Thanks very much.